Hey everyone, Dr. Sonal here, board certified allergist. Let's talk a little bit more about hives. Just because it comes up so often, patients often want allergy testing, or they're told by their primary doctor or the urgent care doctor that they need to be tested for allergies. They want to be tested for everything. I can totally understand the need for that. If you break out in an itchy rash, it's common to maybe assume that it is an allergic issue, but let's keep in mind, if you are allergic to something, there would be a time relationship to the thing that you're allergic to, the trigger, and when your symptoms happened. Okay, so again, if you tell me you started a new product, got a new pet, started a new medication, whatever the case may be, and then the issue happened right after, then it may make sense that you might be allergic to that, right? But most people who have chronic hives, again, that means for greater than 6 weeks, this is what we call idiopathic, or meaning there's not really a specific reason of why you're having the hives. We think it's an autoimmune, autoallergic response. So yes, it is allergic in some ways, but not allergic to one specific thing. Well, the best way to maybe think about it, two ways to think about it, is that your skin is overreacting right now to everything. Anything might trigger it off. It might be heat, it might be alcohol, it might be medications, it might be just the act of eating itself, not necessarily the specific food. So again, your skin is overly on hyper alert is maybe a way to think about it. And another way to think about it may be looking at the analogy of having a cup. If you have a cup and then you add some more water to it, then you add some more, then you add some more, eventually what happens? The cup overflows, right? So when you break out in hives, your cup is overflowing. Different things might have contributed water to that cup. It might have been hot that day. Maybe there was a lot of pollution. Maybe there was stress. Maybe your hormones, whatever it may be, you kind of put it all together. Your cup overflows. And some people are prone to having these breakouts, right? You may have had each one of those things individually. You'll tell me, doctor, I've had stress before. Or it's been a hot day before. Yes, but you kind of put everything together. It's that perfect storm of events and you break out in hives. And so maybe that's a better way to think about it, so that instead of focusing on the why, then we can focus on how to get you better, right? Because this condition, while it may not be life-threatening, is very, very uncomfortable, very difficult to live with, definitely affects quality of life. Your sleep is going to be affected, right? It's difficult to go out in public like that. So all sorts of things, right? So again, talk to your primary care provider, talk to your allergist about treatment options. There's a lot of treatment options, and over the last few years, we've been lucky enough to have more treatment options other than just antihistamines. Steroids are not a great option for something that is a chronic condition, right? Even on acute terms, patients are often given steroids, and there's a rebound effect. As soon as you stop taking the steroids, the problem is worse. So I would really, really avoid the steroids if you can. Long-term other options other than antihistamines, in the past we've used immunosuppressants, things like cyclosporin, but of course those come with side effects. You have to monitor your kidney function, all sorts of things. So now we at least have 3 other options that, affected from a unique, different mechanism of action. We have an oral medication, remibrutinib, that just came out, which is a Bruton's tyrosine kinase inhibitor. We've had biologics, IL-4 and IL-13 inhibitor, dupilumab, and we have an anti-IgE antibody, omalizumab or Xolair, that have all been approved for chronic urticaria. So again, find an allergist, find your local allergist. Let me know if you have any questions down below in the comments. Thank you.